Very good evening to all of you. Myself, Dr. Prateek Garg. So, we will discuss about granulomatous diseases of the nose. So, let's look out at the table. What are the bacterial causes leading to granulomatous diseases of the nose? First one is rhinoscleroma, and it is caused by the bacteria, which is a gram-negative bacteria known as Klebsiella rhinoscleromatis. So, bacterial causes for granulomatous diseases, rhinoscleroma, then comes syphilis, tuberculosis, lupus, leprosy. So, leprosy, TB, syphilis, rhinosclerosoma, these are some of the bacterial causes which are doing the granulomatous disease in the nose. Let's talk about fungal causes. So first one is rhinosporidiosis. So by the term itself says rhino means nose, sporodiosis means some sort of spores are forming. It is being infected or rhinosporidiosis, the cause is a protozoa. Earlier we used to say it's a fungus, but nowadays rhinosporidiosis we are saying that it is a protozoa with the name of Rhinosporidiosis cibri. What are the other fungal infection leading to granulomatous disease? Aspergillosis, mucormycosis, candidiasis, histoplasmosis and blastomycosis. Let's talk about unspecified cause or some sort of autoimmune disorder. So most important is venous granulomatosis, then comes sarcoidosis, and then non-healing granuloma. So let's talk about rhinoscleroma. Etiology, it is also known as fish bacillus or Klebsiella rhinoscleromatosis, which is a gram-negative bacteria. Rhinoscleroma, this is endemic in North India. These points are very important. Rhinoscleroma is more common in the northern part of the India in the Himalayan range, and the cause is a gram-negative bacteria known as Klebsiella rhinoscleromatosis. Now, what are the clinical features? Generally, these are divided into three stages. First is the atropic stage, where the atrophy of the nasal mucosa or the nasal structures occurs that leads to purulent nasal discharge, which may be foul smelling with lot of crusting in the nose. So appearances of like of atropic rhinitis, so full of the crusting and the foul smelling nasal discharge. So it is atropic stage. Then this stage further proceed to granulomatous stage. In granulomatous stage, nodules are formed in the nose, giving the nose an appearance like a woody hard, like a wood. Very important. So granulomatous stage, it gives the woody feel, and one on nose, it looks like tapir nose. Tapir nose is some sort of pig sort of animal is there, in which the nose is like little bit protruded, widen up with the broad opening of the nose. You know, in normal human body, we have small nostrils and it is pointing downwards. What happened in tapir nose? The nose becomes little bit forward. See, suppose this is my normal nose. Okay. So small opening is there bilateral. Okay, this is my normal. What happens in tapir nose? These nasal holes are coming in the front like a pig, like a tapir. So it's an animal. Look out at the Google. So nose become more flattened. The holes become more anteriorly, more widen up, giving the appearance like a tapir. So nodules are seen in lower part of external nose and the lips, giving the appearance tapir nose, and it is woody hard feel. Generally, these nodules are painless and non-ulcerative. Non-ulcerative, that means if you touch, it would not bleed suddenly. So these are painless and non-ulcerative nodules. Then comes the cicatrizing stage. What happened in this stage? The stenosis of the nose, nasopharynx or the oropharynx will occur, leading to blockage of the airway. So in third stage, it will get stenosed. How does it spread? It spread in the nose, then goes to the pharynx, larynx or trachea or the bronchus. Subglottic larynx is most commonly affected. If we talk about the larynx, subglottic part is the part which is most routinely affected by rhinoscleroma. Now look out at the diagram. How to diagnose rhinoscleroma. This is a picture showing the histopathology. You can see two main elements. One is the Mikulicz cell and other one is a Russell body. What are the Mikulicz cell? The rhinoscleroma bacteria being engulfed by means of macrophages. So as you can see here, large macrophages, they are just engulfing the bacteria. They are stained differently. So macrophages engulfing the bacteria is known as Mikulicz cell, and other one is a Russell body, which are basically eosinophilic inclusion body, which are stained purple. So eosinophilic inclusion body will be there. So these are pathognomic of rhinoscleroma. What is the treatment? Streptomycin, tetracycline are very good in treating the Klebsiella rhinoscleromatosis, and biopsy can be taken. Now let's talk about rhinosporidiosis. Initially we thought it is caused by a fungus, but nowadays we know that it's an aquatic protozoa by the name of Rhinosporidium siberi. Rhinosporidiosis, it is mainly acquiring the immunocompetent patient. Very important, has been asked in the exam. Rhinosporidiosis is present in immunocompetent patient, not immunocompromised patient. And what happens? What is the look? It is having, the patient is having the mulberry or strawberry mass with the white dot. That means a red color mass is there, like over this nose, and between them some white dots are there, white dots. Like this, white dots. White or yellowish dot. So we all know how the strawberry looks. So there is some white dot. So in rhinosporidiosis, mulberry mass or strawberry mass like appearance with the white dots is there, which is determining that, which is showing that there are sporangia of this protozoa. Okay. So what are the clinical features? There will be skin nodules with a strawberry appearance plus history of recurrent epistaxis. That means multiple episodes of nasal bleed will be there. It is mainly acquiring in South India like Tamil Nadu or Kerala. So mainly in the southern part of the India. We know rhinoscleroma, it is mainly in the northern part of the India, whereas rhinosporidiosis, it is in the southern part of the India, that is Tamil Nadu. Rhinosporidiosis, important points, affecting immunocompetent patient. Causative agent is a protozoa. Appearance is the strawberry mass with a white dot. And there will be history of recurrent epistaxis. Treatment is wide excision of these nodules or the fungal mass, or we can say protozoal mass, followed by cauterization of the base, and we can also use dapsone in the post to this cauterization of the base. We can use the dapsone. Now one important point to remember, strawberry-like appearance. We are not saying the strawberry mass with the whitish dot. Strawberry look-like appearance of the nose, that happens in sarcoidosis. Whereas the mulberry or strawberry-like mass with the white dot is the pathognomic feature of rhinosporidiosis. I'll show you in the next slide. Now syphilis, again another granulomatous disease. So early congenital or late congenital syphilis. So late congenital, it is more common. In early congenital syphilis, there will be snuffles, whereas in the late congenital state, there will be gumma over the nasal septum. Then primary syphilis, secondary syphilis. Primary syphilis, what happens is the chancre is present over the vestibule of the nose. In secondary syphilis, generally the rhinitis, crusting, fissuring of the nose symptoms are there. Now, tertiary syphilis, it is the most common presentation in the nose. Important for the exam, which is the most common type of the syphilis, which is this in the nose. It is tertiary syphilis is the most common in the nose. Look at the diagram of the baby, how the syphilitic baby appears. Now lupus vulgaris, it is a low-grade TB of skin. So lupus vulgaris is nothing else but the tuberculosis of nose or tuberculosis of the skin, which is low grade. What is the pathognomic feature? Apple jelly nodules on the vestibule. You can see here apple jelly nodules over the vestibule. So it is pathognomic of lupus vulgaris. Let's talk about sarcoidosis. So it is violaceous affection of skin and the tip of the nose. Look at the picture. It is purple color, violaceous appearance of the skin, known as lupus pernio. So sarcoidosis of the nose is also known as lupus pernio, and lung involvement is most common in sarcoidosis. And nasal mucosa, it appears strawberry. So in rhinosporidiasis, the nasal itself is looking like strawberry mass, some sort of protruding mass with the whitish dots, whereas in sarcoidosis, only the nasal mucosa is somewhat strawberry-like look.